We're working hard to end COVID-19 and to take advantage of the incredible economic opportunities available right now in Kentucky. At the same time, we have to take on long-standing challenges like addiction and substance use, which are hurting too many Kentucky families. Last year, nearly 2,000 Kentuckians died from a drug overdose, a 49% increase just over the previous year. Heartbreakingly, this was also a record for the most overdose deaths recorded in a 12-month period. And 2021 could possibly be deadlier, as more people are losing their lives to synthetic opioids like fentanyl, which is especially dangerous. This is just unacceptable. I've made this fight against opioid abuse a priority, going back to my days as Attorney General. I took on the greedy, heartless drug companies and others that flooded our communities with pills. My office also oversaw the Rocket Docket program to get people struggling with addiction out of the courtroom and into treatment. And I worked with lawmakers to direct $8.8 million from the Purdue Pharma settlement to fund substance use treatment programs. As governor, I was proud to announce $4.6 million in grant funding. It's going to help us expand treatment and recovery services. We announced that earlier this year. I'm also proud of the work being produced by CORE, the Kentucky Opioid Response Effort, and our Department for Behavioral Health, which received its third round of two-year grant funding of $35 million last September. With these dollars, CORE is investing resources in communities to expand prevention, harm reduction, treatment, and recovery efforts. The Justice and Public Safety Cabinet, Office of Drug Control Policy, and Administrative Office of the Courts are also working to expand treatment options because we know we can't arrest our way out of this crisis. Medicaid is expanding coverage and decreasing barriers to treatment. And there are numerous other efforts underway as well. But even with all we're doing, with our partners across the state, there's still so much more that has to be done. We need more partners and more resources to win this fight. That's why I'm proud to announce the Commonwealth is joining the Bloomberg Philanthropies Overdose Prevention Initiative to address the opioid crisis in Kentucky. Bloomberg has pulled together an all-star team for this effort, including Johns Hopkins University, the CDC, the Pew Charitable Trust, and more. This public-private partnership has a 5-year timeline, and its goal is to save the lives of Kentuckians by increasing access to medications and expanding preventative services. Kentucky, we're only one of 7 states invited to participate in this initiative, which is going to provide us with valuable resources, funding, and expertise. We'll be announcing more specifics about the partnership as we develop our plans with Bloomberg and other collaborators in the months ahead. I want to give a big thank you to everybody at Bloomberg Philanthropies for joining Team Kentucky as we work to save lives, prevent tragedies, and restore a sense of hope and possibility to Kentuckians struggling with addiction. Thank you, and God bless our Commonwealth.